I see this all the time. People come to me after 10 or 15 physio sessions and they're still in pain. Most of them tell me the same thing. Half their time was spent lying on a table getting some kind of passive treatment, and the other half was doing generic exercises or stretches, like the typical mobility stuff you see on Instagram. What nobody's ever explained to them is which postures or movements provoke their pain and why. Nobody's found the pattern. So they walked away thinking they were broken, whereas in reality, they were never actually properly assessed. If you've been to physio and you still have low back pain, it's probably not because exercise in general doesn't help. And it's probably not because your case is hopeless and you should resign yourself to living with back pain. It's much more likely that you were never assessed to find your specific pain triggers. Something that gets used a lot in this field is the term non-specific low back pain. It sounds like a diagnosis, but it isn't. It just means that nobody's done the work to figure out which movements, postures and loads are aggravating your spine. So you get given the same generic treatment as everyone else. Last year, a major systematic review of low back pain treatments found that only around 1 in 10 treatments show real lasting benefit. That appalling statistic isn't a surprise to me. It's just what happens when people with different types of low back pain get sorted into one big group and handed the same generic program. But two people can both have non-specific low back pain and have completely opposite pain triggers. One person's pain gets worse with bending forward. Another person's pain gets worse with arching back. Give them the same program and you'll help one and hurt the other. Now, I want to be clear about something. I'm not here to badmouth physios. There are some excellent ones out there. The problem is bigger than any one person. It's the system that many of them are working inside which has a number of problems. First, the time problem. A proper assessment takes about 3 hours. First, I need to understand your personal history. Then I need to take the time to actually test which postures and movements bring on your pain. Then I have to teach you how to avoid the pain triggers we've just identified. And finally, coach you through an exercise program that's designed around what we found during the assessment. With most people, I struggle to do that in less than 3 hours. The problem is that a 3-hour assessment isn't even billable on medical insurance. Most people get 30 or 45-minute sessions on their insurance, so the treatment starts before an in-depth assessment can be done. Which leads to the money problem. Passive treatments and machines are easy to bill. They're quick, they're scalable, so they get used a lot, not because they're the best option, but because they fit the system. They may make you feel better temporarily, but they won't help you avoid provoking your pain or develop resilience. Client after client tells me the same thing, that half their sessions were spent lying on a table. Then we have the belief problem. This one's more controversial, but it matters. A lot of modern physio training leans on something called the biopsychosocial model. Part of that model says that pain has a psychological component, and that is absolutely true. It does. Pain occurs in the brain, I do not question that. But here's where it goes wrong. If a movement hurts during rehab, some physios will tell a client to just push through it, because the belief is that the brain is amplifying pain that isn't a result of tissue damage. And sometimes that may be right. But other times, the real issue is that the movement is putting load directly onto damaged tissue, such as a herniated disc, and pushing through it is making it worse. Psychological factors can absolutely turn the volume up or down on pain that's already there. But there's usually a specific reason for why that pain is there in the first place. If nobody ever takes the time to uncover what that is, you're just adjusting the volume on a problem that you haven't even identified. That is a flaw in the system that favours the easy explanation over the more time-consuming diagnostic work. Let me show you what this looks like with real clients. So Midden had a stressful job, a newborn at home and chronic low back pain that 15 visits to the physio never fixed. No change. By the time he got to me, he was starting to lose hope. When I assessed him, it was clear that he was intolerant of flexion. Yet part of his treatment had included movements that flexed his spine. I showed him exactly what to avoid, and just as importantly, I showed him things he could safely do that he'd become too scared to do for fear of provoking his pain. He's now had about 3 months with no low back pain. That last line of his testimonial highlights a really important point. Recovery isn't something that happens to you. It's something you participate in once you know what you're working with. So Najma had been living with low back pain for 4 years. Her physio gave her mobility work and stretches. Nothing changed. When I assessed her, the first thing I noticed was tension in her sciatic nerve. And it was being aggravated by the exact stretches she'd been doing for years. She also had a herniated disc that some of her exercises were aggravating. I explained to her what the problem was, and once she stopped those movements and learned how to stop moving without stressing her disc, her pain started to go away. And more importantly, she felt empowered and in control of her pain. Manjeet had 7 years of what he thought was chronic low back pain, but it was actually repeated bouts of acute pain that kept getting triggered by the same movements over and over. He tried different physios, acupuncture and other specialists, but nobody had ever taught him how to hip hinge properly. So he kept flexing his spine in a way that irritated the damaged discs he had. Once he learned to move without doing that, and spent the following months building up the endurance of the muscles that stabilise his spine, he became pain-free. I checked in with him recently. 3 years later, still no low back pain. None of these 3 people were as hopeless as they felt. Each one had a specific, identifiable pattern causing their pain, but nobody had ever taken the time to find it. Once it was found, they could get on the path to recovery. So, what does identifying the cause of your low back pain look like? First, I need to understand your history and how you ended up coming to see me. So, previous injuries, surgeries, your job, the activities you do or don't do, your lifestyle, how you sleep, and the features of your individual anatomy, including the structure of your hips and your ankle and shoulder mobility. These all affect how much force you transmit through your spine. Then comes provocative pain testing. We need to find out which specific movements, postures and loads provoke your pain. Bending forward, arching back, twisting, sitting too long, standing too long, lifting, sudden movements. Everyone's different. This gives us a good idea of what's likely driving your pain. Then I need to teach you how to avoid provoking your pain in your daily life and in the gym. That's what I mean by spine hygiene. It's not a treatment, it's learning how to move in a way that doesn't trigger your pain and allows your spine to heal. Then comes the coaching of your personalised exercise program. This is based on what we found during the assessment. If something doesn't work, we adjust it. Then your program gets updated according to your progress over the weeks that follow. You're not just given some random list of exercises and stretches that change depending on who you happen to be booked in with that week. If you take one thing from this video, it should be that the problem is unlikely to be you. And it's probably not that exercise in general doesn't work. It's much more likely that you were never properly assessed to find your specific pain triggers. Once you know your pattern, which movements hurt, which loads you can't tolerate yet, which postures are keeping you in a cycle of pain, everything changes because you know what to avoid. You know what's actually safe to do. And this is empowering because you can finally take control of your pain. Unfortunately, the healthcare system isn't set up to offer this type of in-depth assessment. But now you hopefully have a better idea of what to look for. If you'd like to find out more about the assessment I use to help Midden, Najma and Manjeet, click here to watch the next video.